Today's webinar will begin in approximately 1 minute. I'd like to welcome you all to today's webinar. My name is Jay Hodes. I'm the president of Collington Consulting, and I will be conducting today's webinar. The webinar will be recorded. We have a number of individuals that could not attend and asked us to provide a copy of the presentation. A little housekeeping. I'm going to allot plenty of time for Q&A at the end of today's presentation. With so many people on today's webinar, if you could please use the Q&A option to submit your questions. And with that, we'll go ahead and begin. Again, welcome to today's webinar on HIPAA compliance, recent enforcement actions, and proposed rules changes. Again, my name is Jay Hodes. I'm the president of Collington Consulting. A little bit about me, over 12 years providing HIPAA compliance services. I served as the HIPAA compliance officer for the county of Fairfax, Virginia. I'm also a former assistant inspector general for investigations at the U.S. Department of Health and Human Services. Probably have over 40 years of combined experience with risk assessments, site security evaluations, policy and procedure assessments, HIPAA compliance program implementation, and federal law enforcement management. I've served as a subject matter expert for litigation cases. I've worked with organizations that have experienced breaches, and when I do have some free time, I volunteer for lab rescue of the Labrador Retriever Club of the Potomac, which is located in the greater Washington, D.C. metropolitan area. So a little about me. Let's jump right into it. So what are we going to cover today? I'm going to begin with just an overview of HIPAA compliance regulations and requirements. I just want to make sure we're all on the same page and understand what needs to be in place, what are the regulations when it comes to HIPAA compliance. We're going to look at what a HIPAA security incident is and a reportable breach. This is going to be important for understanding the enforcement actions. And again, you'll see there, we're going to cover these enforcement actions, and I will have a slide on messaging. This is kind of important in terms of looking into the crystal ball to determine what direction enforcement is going in. And then we're going to talk about the HIPAA Security Rule modifications, and that's important. I do anticipate that probably coming sometime this year, early next year. So we're going to look at some of those significant areas. And we'll just conclude a little bit about some of the services my company provides. And as I mentioned, there'll be plenty of time for Q&A. As I mentioned earlier, please use the Q&A option to submit your questions. So what is HIPAA? It's the Health Insurance Portability and Accountability Act of 1996. And why is 1996 underlined? This is a dated regulation. And we're going to talk about these changes further into today's presentation. But HIPAA set the federal statutory basis for establishing standards for the privacy and security of protected health information. We see that acronym all the time, PHI. Sometimes we'll see EPHI, which is electronic protected health information, kind of interchangeable and synonymous terms, EPHI and PHI. In 2009, the HITECH Act was enacted, the Health Information Technology for Economic and Clinical Health Act, and it went to promote the adoption and meaningful use of health information technology. And what it did is it cleaned up some of those original HIPAA requirements that were put into place in 1996. And it developed a new breach notification rule, which we're going to talk about in the middle of the presentation. It requires business associates to report security breaches to covered entities consistent with notification requirements. We're going to define both business associates and covered entities in just a second. And then in 2021, there was an amendment to HITECH, which is really what we call the recognized security practices. So it's optional, but if you do have a breach and you're investigated by OCR, then if you can demonstrate you've had these recognized security practices in place, it will help your defense during the investigation. And really the last legislative update is the omnibus rule. And this helped to clean up the original HIPAA requirements and HITECH. And it requires that HIPAA privacy and security requirements be utilized by business associates and their subcontractors. And it holds business associates to the same standards for protecting PHI as covered entities, including those subcontractors. And it put a little bit more teeth into the penalty side and enforcement. And we're going to talk about the enforcement agency next. So who enforces HIPAA compliance? It's the U.S. Department of Health and Human Services, Office for Civil Rights, their acronym OCR. They enforce HIPAA throughout the country. HIPAA can also be enforced by the Attorney General of each state. So why do I have the seal of the New York AG? Because New York State has been very aggressive when it comes to enforcing HIPAA compliance, along with New Jersey and probably California as the three states that I see most active when it comes to HIPAA enforcement. So this is a classic definition of risk mitigation: steps taken to control or prevent a hazard from causing harm and to reduce risk to a tolerable or acceptable level. Well, HIPAA is an exercise in risk mitigation, right? The goal here is to prevent a breach of PHI from occurring, or protected health information. If you go back up to the first sentence, why is that part of that sentence underlined? Reduce risk to a tolerable or acceptable level. It doesn't say eliminate risk, because that's virtually impossible to do. We have a lot of human error when it comes to causing HIPAA breaches. And we have technology faux that have also caused breaches to occur. But really, it's a balance of your business operations to get it to that acceptable level of risk for any organization that's required to comply with HIPAA. So there are two primary rules that govern HIPAA compliance. The first we'll talk about is the security rule. And it sets the standards, the security standards for protection of electronic protected health information. It requires appropriate administrative, physical, and technical safeguards to ensure the confidentiality, integrity, and security of ePHI. And we're going to talk about the proposed modifications to the security rule towards the end of the presentation. The other primary rule is the HIPAA privacy rule. And the privacy rule created national standards to protect individuals' medical records and other PHI, especially considering electronic healthcare transactions. It created safeguards that providers and plans must use to protect PHI, sets the limits on the use and release of health records, and parts of the privacy rule apply to business associates. So when you can see when the security rule and the privacy rule were created, the emphasis was that health data was now being electronically transmitted, right? The old days were gone when we had paper charts, though there are still some organizations that utilize paper charts. But this is kind of at the early stages of when EMR, EHRs were being implemented. So the concern was, when the legislation was created, it's like, how do we protect Americans' health records when they're being transferred electronically? So again, the privacy rule kind of talks about when the information can be released. The security rule sets the standards for securing the electronic health records. So who must follow the security rule? We talked about this at the beginning. There are two categories of individuals, organizations, agencies, and businesses that must comply. And those are referred to as covered entities and business associates. Covered entity, any provider of medical, dental, or other healthcare services or supplies that transmits any health information in electronic form. This includes health plans and clearinghouses that perform billing functions. Then there's the business associate. So with certain exceptions, a business, and an individual, an entity, if they create, receive, maintain, or transmit PHI for function and activity regulated by the privacy rule for a covered entity, they'll be considered a business associate. Basically, a business associate is going to have access to that covered entity's PHI or ePHI to provide their services. Some examples: IT, cloud storage, data analytics, accreditation, billing services. That's what makes these types of individuals, it can be an individual, organizations and companies, a business associate. So when you have this relationship between covered entities and business associates, a business associate agreement must be in place. And this agreement kind of specifies the protections that have to be in place in accordance with the HIPAA guidelines and requirements. A BAA must be in place between a covered entity and all their business associates. A BAA can also be between a business associate and a subcontractor business associate. So what I like to talk about here, it's that downhill flow of ePHI. So if you're a healthcare provider and you contract out managed services, your IT, to an IT company, and that IT company then contracts out to provide your practice cloud storage, and the contract for cloud storage is between the cloud service provider and the IT company, that cloud storage provider or CSP would be considered a subcontractor business associate, and your IT company would have to have the BAA in place with that cloud service provider. Even though it's technically that provider's PHI or ePHI, that's how this process works. So just for clarification purposes, a BAA is not a contract for services. Sometimes I'll see, especially with EMR and EHR companies, where the BAA gets embedded into the overall service contract. I'm not a huge fan of that, but it does occur, especially when you're dealing with larger organizations. So again, just wanted to cover business associate agreements. So there are three major components of a HIPAA compliance program, and these are required by the HIPAA regulations. The first is having a HIPAA risk management plan, which is your policies and procedures. And not to get overly technical, but your policies and procedures must cover all of the HIPAA security standards and implementation specifications. There's about 50 of those, along with breach notification policies. And in most cases, the risk management plan will have a section on your privacy policies and procedures. It may have supporting documents, but this is part of the requirements for the overall security management process. So when we talk about the requirements, everything is based on the Code of Federal Regulation, the CFR. And then there are certain what we call citations for those CFRs. If you do research on the HIPAA regs, it's not uncommon for the citation to say 164.308, parentheses, small a, something along those lines. So what you see up here, these three components are all required by the regulations. We talked about the risk management plan. Next is conducting a HIPAA security risk assessment. That is required by the regulations, and conducting HIPAA security awareness and privacy training. Why am I talking about these three components? When we get to the enforcement examples, we're going to see organizations that kind of got themselves into trouble because they didn't have some of these requirements in place. And I'll kind of walk you through the process in terms of, when OCR decides that they're going to formally investigate an organization. So let's just talk about a security incident, because again, we're going to lead up to some of these enforcement actions. So I apologize for the first bullet. That comes right from those CFRs, and it is stuck in government speak. So security incident means the attempted or successful unauthorized access, use, disclosure, modification, or destruction of information or interference with system operations in an information system. That's how it's defined. The security incident should trigger the activation of your organization's incident response plan to determine if the incident was a potential breach of PHI or EPHI. This initial assessment will lead to a determination whether the incident should be elevated to the level of reportable breach. You must complete an internal incident report form and log that. It should stay an internal process. Why are there asterisks? Because if you're subject of an OCR investigation, they're going to ask you for copies of your incident report forms along with your log. So again, this is why a security incident should always have a report completed. So a security incident may be if you get a laptop, organization's laptop gets stolen or lost, that could be a security incident. We're going to talk about the difference between that and a reportable breach next. So a HIPAA breach is the release of unsecured PHI or EPHI to an unauthorized entity or in an insecure environment, whether intentional or unintentional. An impermissible use of disclosure under the privacy rule that compromises the security or privacy of PHI or EPHI. An impermissible use or disclosure of PHI is presumed to be a breach unless the organization can demonstrate there's a low probability that PHI has been compromised based on an assessment of at least the following factors. Now, this is what the regulations call for. I'm not a huge fan of this methodology. I'll explain that in just a second as to my opinion on this. But what are the factors that you look at? The nature and the extent of the PHI or EPHI involved, including the types of identifiers and likelihood of re-identification. Remember, there are 18 specific identifiers of PHI. Number two, the unauthorized person who used the PHI or to whom the disclosure was made. Whether the PHI was actually acquired or viewed, sometimes it's difficult to make that determination. And then I put a lot of emphasis on the last one, the extent to which the risk to the PHI has been mitigated. Now, you must complete what's called a breach risk assessment. This is different than the security risk assessment. This is really a decision tree process that you go through. You look at the 4 factors. And again, what you have to do is determine there's a low probability that PHI has been compromised. Why don't I like this? Because as a HIPAA consultant, that's someone that's been in this business for a while, I don't know what a low probability is. OCR doesn't specify that if it's less than 25%, it's not reportable. If it's greater than 50, it is reportable. So again, what I typically do when I help out clients, I go through the analytics of looking at these 4 factors and then really look at the last one. How, when was the security incident discovered? What was done to mitigate this potential breach? And I think that is significant in terms of trying to make this determination. To be honest, if I do have some doubt, I usually err on the side of caution and advise clients that they should file a breach notification with OCR. We're going to talk about that process in just a few minutes. So let's go back to our example of the security incident of a lost or stolen laptop, right? So you have a provider that leaves their laptop in their vehicle and they stop at Starbucks, and when they come out, their laptop's gone. So obviously they probably want to file a police report. But now we're going to look at does this rise to a reportable breach? So let's see what was on the laptop. Did the laptop have full disk encryption? If it did, then to me, the risk was mitigated. If there's attestation that there was nothing on the laptop, everything was cloud-based, again, to me, that's only a security incident, doesn't rise to the level of reportable breach. However, we take that a step further. The provider indicates that they had taken a bunch of screenshots from their EMR, EHR, so they could review kind of their notes when they get home later that day. And it resided on the hard drive. And if that laptop was not encrypted, then to me, that's going to rise to the level of reportable breach. We may not know at this point who the unauthorized person was who got the information, whether it was actually acquired or viewed. But again, to me, there's a higher probability of a potential breach of that information. So again, I'm going to advise that we're going to file a breach notification with OCR. I'll be happy to answer specific questions about this when we get to the Q&A. So I really want to touch a little bit on cybersecurity and HIPAA because that's kind of lead up to both the enforcement actions and the potential changes that are coming. This is significant. Whenever I run webinars or training, I now include a comprehensive section on cybersecurity and HIPAA. This will be kind of minimized here for today's presentation, but I'll cover a couple of the key points. This is astonishing. 81% of all HIPAA breaches were hacking or IT incidents, and that was through September 30th of last year. That's the last time HHS has pushed out updated stats. That number is incredible. That number continues to rise every year. So you can see why now there is a significant emphasis on the need to implement cybersecurity safeguards. What I like to say is what's happened over the years, our banking and financial institutions have learned that they were a prime target for bad actors. And what have they done? They've hardened their systems, right? They've required MFA, multi-factor authentication. So if you're on your phone, you're trying to get into your bank account, you're waiting, you got to wait for the text with a code, right? You got to flip through the screens, but that's for our own protection. Well, regrettably, the healthcare sector is just starting to catch up with that, right? So again, when we get to some of these proposed modifications, you're going to see this emphasis on cybersecurity safeguards, but that is just an incredible number. And then ransomware attacks. I think we all are now aware of what a ransomware attack is. It's when an individual gains access, usually through some type of malware, through a phishing email, and they can get to your database, right? They can get your on-prem file server, they can get your cloud storage, and what do? They encrypt it. They lock down your data, and they're going to require you to pay a ransom to get that back. Ransomware attacks are considered reportable HIPAA breaches. There have been numerous reported ransomware attacks in the healthcare sector, and as I said, they continue to grow. Now, how do you mitigate something like this, right? If you are backing up your data, let's say that you do have a redundancy backup and you are a victim of a ransomware attack, if you can restore your data, then you're not going to have to pay the ransom. You're still going to have to file the breach notification. But I mean, it's going to be a business ops issue at that point. If you provide critical healthcare services, obviously you're just not going to click up the mouse and get all the data restored, right? It could take days or weeks to get all of your data back. But the point here that I want to make is one of those preventions is making sure that you sufficiently back up your data. So if you're a small to mid-sized practice and you do outsource your IT support, again, just make sure that you work with your IT or managed service provider and ensure that all of your data is being sufficiently backed up. And I mean all of your data. So breach rule notification requirements. There are really two categories: breaches affecting 5 or more individuals, breaches affecting fewer than 500. So breaches that affect 5 or more individuals, there's 3 things that have to occur. You have 60 days to notify the individuals, probably by first-class mail, and there's specific content that has to go into the letters. You can do it by email, but again, we're probably going to use first-class mail. Second thing, you have 60 days to notify OCR through their online breach reporting portal. We'll talk about that in just a second. The third thing that gets overlooked is you're required to do a press release. And I believe the guidelines say that it has to be to a reputable or notable media outlet. So, you know, the major newspaper within your city or town, your local ABC or NBC affiliates. So your HOA monthly newsletter probably doesn't qualify for one of those media outlets. But again, when you do the press release, it's really the same content that's within those letters. So 3 things: 60 days to notify the individuals, 60 days to notify OCR, and then doing the press release. Breaches affecting fewer than 500, 2 things occur here. You have 60 days to notify those individuals, again, by first-class mail or email. In terms of reporting timelines to OCR, that changes a little bit. You have 60 days from the end of the calendar year. So we're running today's webinar on May 20th, 2025. So if your organization discovers a breach today that affects fewer than 500, technically you'd have until March 1st, 2026 to make that report to OCR. We always recommend, once you figure out the who, what, why, when, how, and when the breach occurred, make that notification to OCR. And then I know this is a little grainy. When you do report breaches, this is an open source database. I think some organizations aren't aware of this. It's the HIPAA breach reporting portal. In the industry, we call it the wall of shame. And it will identify the organization, the number of individuals affected, and how the breach occurred. I think in a couple examples you can see here, network servers, email, but this goes up onto the public database, and these are all open investigations, I believe going back for 2 years. So again, it does provide some poor publicity for the organizations, especially if they do the press release. So just be aware that breaches affecting 500 more individuals go on the breach reporting portal. And then we have state data breach notification laws. What's significant here is that every state has a different set of requirements. And what's important here is really that last bullet. The reporting requirements are based on the state the individuals reside in. So if your practice is located in one state, but the individuals, the patients reside in another, you're responsible for that state's breach laws. And again, it varies from state to state in terms of the number of individuals. My recommendation, besides the HIPAA requirements, just make sure if you are the compliance officer or you're working with counsel that you understand what the state data breach law notification requirements are. So what are the penalties for HIPAA violations? Well, they're based on a level of negligence for non-compliance. There's actually a 4-tier approach. And civil monetary penalties, these are not inflation adjusted. I believe that 100 now is now 171, but you get the point here. They range from 100 to 50,000 per violation of each compromised record. A maximum penalty of 1.5 million per year for identical provisions, which in government speak means if they're not identical, it can exceed that. There's been a record settlement with Anthem Blue Cross Blue Shield a number of years ago, in which that settlement was $16 million. And then also criminal penalties can result in jail time. I've seen a couple cases out of Tennessee. They were individuals working for hospital systems that were stealing patients' information, selling them to brokers. Subsequently, there were 5 or 6 individuals involved in this case, and all, I believe, received federal prison time for these violations. So again, just be aware of what the penalties are. Okay, we're going to move into the enforcement action. So let me just say up front, I am not picking on any of these organizations. As I mentioned, this is all open source. So when OCR settles a case with an organization, there's what's called a resolution agreement and a corrective action plan, the CAP. Those are all publicly posted on the HHS website. I read through all of the resolution agreements and all the corrective actions plans. Why? Because they're great learning tools. It gives me insight in terms of what OCR is looking for. So let's just go through a few of these. So there was a settlement announced last week with Vision Upright MRI, relatively small in the big picture, $5,000. The organization, besides the resolution agreement, was put on a 2-year CAP corrective action plan. Why was this significant? And I'm going to talk about messaging in just a few slides. OCR, in my opinion, went out of their way to identify this organization as a small provider, which kind of leads into number 2 with comprehensive neurology, also indicated as a small provider. This one resulted in a $25,000 settlement and also a corrective action plan. I'm going to talk about message sending in just a couple slides, but just keep in mind that 1 and 2 were relatively smaller organizations. You see the next one. This was a phishing attack with breach. The organization was called PIH Health. I was saying it's PIH Health. Substantial $600,000 settlement. This one occurred April 23rd. So let me back up just for a second, because I think there's been misperception in the healthcare sector. I've done a number of consultations. I've spoken to a number of folks in the industry, and I believe this misperception was that under the current administration, there was going to be all this rollback of regulatory compliance requirements across the board in all these agencies. Well, it's apparent that that is not the case when it comes to HIPAA enforcement. So again, having served in federal government for a substantial number of years, understanding the politics of this, none of these enforcement actions would have been announced without the White House knowing of these. So again, this is one area where enforcement is continuing. There is going to be no rollback of HIPAA enforcement actions when it comes to HIPAA violations. So I just want to kind of put that out there. So let's continue on with these other enforcement actions. Guam Memorial Hospital, yes, because they're a territory, they still have to comply with HIPAA requirements. A $25,000 settlement. This is a ransomware cybersecurity investigation. The number 5, Northeast Radiology, substantial $350,000 settlement, also with corrective action plan. That was a security rule violation case. Next one was also a security rule violation case with Health Fitness Corporation, $228,000 settlement, and a corrective action plan. You can kind of see the sequencing here. These announcements have been routinely occurring. And then the final two, CMP. So that's civil monetary penalty. So what happens is OCR, when they investigate, they will tell these organizations they're going to impose a civil monetary penalty. And the goal here is to get the organization to the settlement table, right? Because if they can settle with the organization, create the resolution agreement, they can put you on a corrective action plan. Now, in these two cases, the organizations can choose, you know what? We're just going to accept the CMP, the civil monetary penalty. We're not going to try and negotiate, a lower penalty here. We're just going to accept it. Maybe they don't want to open up themselves to more of internal investigation. Again, what their counsel obviously advised them to do was to accept the CMP. So number 7, a $200,000 penalty against Oregon Health and Science University for failure to provide timely access to patient records. So there is an initiative that OCR started a number of years ago in terms of providing timely access for individuals to get copies of their records. Remember, there is a 30-day requirement to provide records to individuals when requested. And then the last one, $1.5 million civil monetary penalty for cybersecurity hacking, and it's against that eyeglass company, Warby Parker. Again, don't know the internal discussions, but both of these organizations decided, you know what, it's just better that we take the penalty and let's move on. So again, there's been 8 significant enforcement actions under this current administration. If I was to look into my crystal ball, I expect these to continue. And why is that? Because there's been significant number of penalties. And this amount doesn't include any of those settlements that we saw. HHS has not updated their website. But as you can see here, excluding those 8 cases, there's been over $145 million in settlements. And obviously with the Warby Parker, that number is going to go up even more. 100, I'm not a math major, but somewhere, 146 if you add all those up. So a significant amount in HIPAA settlements and penalties, which kind of leads me to this slide. And I realize that some of this is kind of small print, but let me talk about OCR enforcement messaging. What does that mean? So when OCR settles a case, they do a press release, and you can read all of these press Sorry about that. It looks like we had a minor technical glitch. It looks like we're all back. So what you see here are quotes from the press releases. Most of these come from the acting director of OCR. So this is message sending, right? This is heads up, healthcare sector. We're going to continue to enforce HIPAA compliance. We're firing our warning shots. We're letting you know that you must, right? You can kind of see some of the language in here. Small healthcare providers also must comply with the HIPAA rules. I've worked with numbers of dental practices. In some cases, they think we don't have to comply with all of that. But again, not true, misperceptions. You can see the quote, small providers must also conduct accurate and thorough risk analysis to identify potential threats and vulnerabilities to protected health information and secure them. Effective cybersecurity requires proactively implementing the HIPAA security rule requirements before a breach or cybersecurity incident occurs. You can see the rest here. Prioritize compliance with HIPAA security rule risk analysis requirements. Failure to conduct the HIPAA security risk assessments puts this information at risk and vulnerability to future ransomware attacks and other cybersecurity threats. A failure to conduct a risk analysis or assessment often foreshadows a future HIPAA breach. Conducting an accurate and thorough assessment is not only required, but the first step to prevent or mitigate breaches of EPHI. And again, implementing and complying Hey, sorry, looks like we're back. Hopefully we had some folks stick around. I'm just trying to bring the PowerPoint back up. Okay, looks like we're back on. So I believe this was the last slide that I was on. Hopefully everybody stuck around. Thanks. So again, as I was saying, this is message sending, right? So, my recommendation is that if you don't have your HIPAA house in order, if you haven't met these regulatory requirements, now is the time. And why is that important? Because as I mentioned earlier, why does OCR make examples out of organizations? Because when they start their investigation, they're looking to see if the organization made a what they call a good faith effort to implement the HIPAA requirements. So if they conduct an investigation and they see, well, they haven't generated policies and procedures, they've never conducted a security risk assessment, and they haven't trained their workforce in like 2 years, they're going to probably look to impose a civil monetary penalty, even if it's a minimal amount. So this is why it's important that you have a comprehensive HIPAA compliance program in place. And it takes program management. It doesn't mean like we just create the policies and we stick them on the shelf, or we conduct the risk assessment once every 3 or 4 years. And if they ever OCR ever knocks on the door, we can show them we did it. It does take program management. I can't tell you that it's 5 hours a day or 10, depending on the size of the organization. But again, this is message sending. This is them sending the warning shots that even small to mid-sized organizations, there's nothing out of bounds. Even if you're a religious nonprofit, OCR is still settled cases with them. So again, that's kind of my message here, that just make sure that you are complying with all the HIPAA security management requirements. And I can talk more specifics during Q&A. So let's now move to the proposed modifications to the security rule. And they're looking to strengthen cybersecurity. Remember, I underlined when these regulations were created, 1996, 2009, 2013. There's been some modifications over the years, but we're dealing with regulations created in the 90s, right? So especially when it comes to kind of the health tech advancements, that a lot of times with the regulations, at least what I find, is you're trying to fit a round peg into a square hole in terms of, how do we make these regulations work for health app developers? So I believe that this is a bipartisan effort in terms of strengthening these HIPAA security rule requirements. So let's just look at some of these. Now, I will say that there'll probably be an implementation period to make the required changes, but organizations should start now to look at the feasibility for implementation. And when you look at these, most of these to me are already considered best practices in the industry. So let's look at those. So all specifications will be required, not to get too knee deep in the CFR language, but if you look at the CFRs and those HIPAA security standards, the implementation specifications, some are required, some are adjustable. If it's required, you have to meet them all. If it's addressable, it's not optional. There's some leadway on how you meet that specification. Now, everything's going to be required. Next one, really what's important here is that you develop a network map that illustrates the movement of EPHI throughout your information system. I have a number of clients that are already doing that. I think that's important because you want to be able to see the flow, especially in larger organizations. If you're using cloud, if you have some on-prem, again, if you have multiple devices that are connecting, you're going to have to generate a network map. The third one should already be done now, right? Notification within 24 hours on a workforce member's access to EPHI, where electronic systems are changed or terminated. I mean, that should be done almost immediately. Strengthen requirements for planning for contingencies and responding to security incidents. There's probably some weakness in those CFRs now, so there's going to be more robust language on what you need to do. And this is kind of the next one's still stuck in government speak. I'll tell you what I think it means. Require regulated entities to conduct a compliance audit at least once every 12 months to ensure their compliance with security rule requirements for each standard and implementation specification. What does this mean? You're going to have to do a security risk assessment annually. Right now, it's not a requirement to do it annually. There's some stipulation as to when to do it. We recommend now all organizations do security risk assessments on an annual basis. As you know, a lot can change within an organization within a year. People leave, people get hired, people's roles change. Do your security risk assessments on an annual basis. The next one, again, best practice should already be done. Requiring the encryption of EPHI at rest and in transit. That already should be done. So again, that's already best practice. We talked about the MFA example. Remember how healthcare was checking up? Now this is going to require the use of MFA. So anytime the user's privileges to EPHI would affect the confidentiality, integrity, or availability of the EPHI, you're going to have to use an MFA. So I would say for any healthcare application within your organization, they're all going to have an MFA on them. That doesn't mean MFA to just get into the network. It's going to mean any application is going to need that MFA. The next one, require vulnerability scanning at least every 6 months and pen testing at least once every 12 months. I do expect some industry pushback on that. So I'll just give you some setup here. So in December, there was a notice of proposed rulemaking that was pushed out by the prior administration. That closed March 6th. HHS received about 4,500 comments on that notice of proposed rulemaking. This is for these modifications. OCR will review all 4,500. They'll take into consideration what the industry individuals' practices had to say. I do expect some pushback on this because vulnerability scanning, if we have any IT network security folks on today's webinar, and pen testing, it can be expensive proposition for small organizations, but I do expect some part of this to remain intact, maybe not every 6 months, but again, organizations need to do that. Require regulators to review and test the effectiveness of certain security measures at least once every 12 months in place of general requirements to maintain security measures. So again, you may have to run some type of tabletop exercise for disaster recovery, your contingency plan, restoring data, and this is now going to be a requirement. Require business associates to notify covered entities and subcontractors to notify business associates upon activation of their contingency plans without reasonable delay, but no later than 24 hours after activation. So remember, we talked about business associate agreements. I fully expect this to now be part of that. And again, there's going to be more burden on those business associates to have to make these notifications to the covered entities. And again, we talked about that downhill flow where the subcontractor business associates will have to notify the business associates. Subsequently, business associates will need to notify the covered entities. Now, this is rather lengthy, the last one. Required business associates verify at least once every 12 months for covered entities, and that subcontractor business associates do it for the business associates, that they've deployed technical safeguards required by the security rule to protect EPHI through a written analysis of the business associate's relevant information system by a subject matter expert and a written certification that the analysis has been formed, that the analysis has been performed and is accurate. That is a mouthful. So written analysis, to me, I'm guessing that is going to be conducting an accurate and thorough security risk assessment, and then written certification. We're going to talk about our services in a second. We're already doing that. We provide attestation letters to our business associates once they meet all the HIPAA security rule requirements. So again, this is just some of those modifications. Like I said, my expectation is that these will be implemented probably sooner than later. So just a little bit before we conclude, a little bit about our services. We are a full service consultancy. So we do most of the heavy lifting. We will create the policies and procedures. We conduct the risk assessments. And again, we develop the risk management plans. It meets the CFR requirements. So I know some organizations, it's fill in the blanks. That's how they create their policy. We do that for you. We conduct the security risk assessments. We don't just give you a link to some self-audit tool and expect you to go on there and answer 150 questions that you don't know the basis for the CFR. They understand what are we asking here? We conduct those. Privacy assessments, although not required by the privacy rule, if you are a covered entity, you still have culpability under the privacy rule. So we conduct a privacy assessment, and it covers the subparts that you see here. Breach rule assessment, that's actually part of our overall security assessment and determine compliance with high-tech, the breach notification requirements. You want to ensure that you do have the policies and procedures for notification there. And then we conduct what we call a cyber and information security assessment. So we talked about the modifications. So we've been out ahead of this probably about 3 years now. And what we do in this assessment is we address some significant cybersecurity topics along with some of the crossover areas of the security, of HIPAA security, physical and technical safeguards. So we're kind of out in front on this one. And we plan to add more questions now based on these modifications to help organizations get ready and determine if some of these requirements are feasible for that organization. We generate what we call a HIPAA compliance program report. We determine how you're addressing the policy and procedures. Again, if we don't do your risk plan, we want to evaluate those. We will look at your training. Again, if we don't provide it, how are you providing training to the workforce? We're going to comment on that. We're going to look at your risk audit and monitoring. We're going to determine if you have a sanctions policy in place. We're going to ensure that you have the right forms and reports. Remember, security incident reports, data collection, current security measures, how you're mitigating potential risk, and again, making sure that you have breach notification requirements in place. We provide HIPAA security awareness and privacy training. We have versions both for covered entities and for business associates. I do a lot of training now, like we're today, and hopefully we don't lose the signal like we did a couple times today, but I do provide it via Teams. We have a lot of clients that prefer that because of the interaction that they can have with the instructor, which is usually me. We will conduct policy and procedure reviews. So if you say, hey, we have a HIPAA risk management in place, Jay, take a look at it. What do you think? Oftentimes we do find some gaps where not all those security standards and implementations are addressed, where some of them are rather weak. When we look at procedures, just as an FYI, sometimes we'll see the policy, which is great because it's just reciting what's in the CFR, but then the procedure is the HIPAA security officer is responsible for implementing the policy. To me, that's not a procedure, right? What does that mean? So again, we want to see some details in there on the procedure. We provide hourly HIPAA consulting. You know, we have a lot of startup health app developers that are clients, and we provide some guardrails for them during kind of their development stages. Another service that's been popular with us, we provide virtual HIPAA compliance officer service, or VHCO. We have a lot of small to mid-sized providers, and they just don't have experienced staff. So we have one of our compliance experts that serves as their virtual compliance officer. And I do provide subject matter expert witness services. I mentioned that kind of in my bio. And then, as I mentioned, we now provide attestation letters for business associates, which I guess when the modifications are implemented, we'll now call this the written analysis. So that's important for business associates. You kind of noted on both the prior slide and this one with the asterisks are compliance requirements. So with that, I know I just said a lot. So I'm going to jump. It looks like a lot of people are on chat. So if you want to submit questions via chat, you can do that. If you want to submit them during the Q&A, I have a couple that have come in on the Q&A side. So let me just read through that. So one of the questions is, how should we update our security risk assessment to stay compliant? So that's kind of a tough question because I don't know the basis of your security risk assessment. So what I always recommend is that it has to be accurate and thorough. What does that mean? It can't be a checklist. So you want to make sure that a security risk assessment addresses the administrative, technical, and physical safeguard requirements found in the security rule. Like our assessments, I painstakingly went through all the CFRs, tried to take them out of government speak, and put them into a comprehensible question, right? So organizations can understand, what am I asking here? So again, that would be my recommendation on how an organization should stay compliant on conducting security risk assessments. And then the other thing that I had mentioned too is that they should be done on an annual basis. So again, more than happy to answer any questions that you have, jumping back and forth between chat and the Q&A. Please ask. Okay, so next question that came in, what are best practices for training staff on social engineering threats? That's a great question. So obviously, social engineering is the use of phishing emails that get rather specific, right? What's social engineering? This is when the bad actors, they get on your social media accounts, right? They see what you're doing. And we know we love to post, right? We were here on vacation. We're doing this today, whether it's on LinkedIn, on a rollout or something. And the bad actors go on there and they say, oh, yeah, Jay was skiing last weekend. And you'll get an email from someone that you think you know saying, hey, how was your ski weekend? Oh, by the way, let me ask you a question about, your data backup policy, right? So what I recommend is that organizations, if they're not doing that, you utilize phishing simulation software. Um, I don't want to mention specific names out there of companies that provide it, but to me, phishing simulation software is a must. And if you don't know what that is, it's when you utilize a service and they kind of send bogus phishing emails to see who clicks on the link, right? And then you get a report, and it's a learning tool, right? So it's to make sure that individuals that are getting emails and being bombarded, and they're so realistic today that you have a mechanism, right? How do you quarantine an email that you're not sure of, right? The goal is to prevent someone from kind of clicking on a link and unleashing that malware or ransomware attack in in your network. Okay, so I'm just kind of going back and forth here. Next question, will encryption become mandatory under the new security rule? I believe it will. And again, to me, that's an industry best practice and it already should be done. All data at rest should be encrypted and all data in transit should be encrypted. If you're using cloud-based EHR, I mean, those portals are already encrypted. If you're backing up to the cloud, that should be encrypted in transit. But I believe that there should be no pushback. The same with even laptops, right? Just make sure that full disk encryption is enabled on any laptop, even desktop, that the organization owns. And again, if you're a small to mid-sized provider, if you try and manage IT in-house, I'm always going to recommend that you use a managed service provider. So next question here that I have is, are the specific MFA tools recommended for HIPAA compliance? I haven't seen them yet, and I think it's really going to, again, this is my personal opinion, that it's going to be dependent on the application, right? And the feasibility of applying an MFA to certain applications. So again, I'm going to say EMR, EHR companies, that probably will be something that they'll be rolling out if they already haven't. But again, you're going to have to look at some of these other applications, or if you utilize on-prem file servers, again, working with a managed service provider to make sure that MFA gets implemented. Like I said, it should already be done, right? Like I said, banking and financials have kind of caught up. All right, so it looks like I've covered anything in Q&A. Let me go back to chat and see. So let's see. It says if you're getting a copy of the recording. I know there's a lot of information we covered here. Hopefully, we're going to have to break it into the two sessions because we did break connectivity at some point. But if you reach out, my contact information is up there. If you want to send me an email, once the recordings, I guess there'll be two. Once they're available, I'll be happy to send you a copy. I'm also going to try and get it up on our website. But again, it's probably going to be split into the two sessions. So again, either email me or I may post something that it will be up on the website. That's probably the best way to do it. And I will be, there is a question on fulfilling the gifts. I do have a list of the first 5 individuals that enrolled. I just need to verify that you did attend, and I'll be happy to send out those gift cards by email at the email address that you used to register. Let's see. Let's go back to, we're going back to the Q&A side. So here's one. How will HHS monitor implementation of technical safeguard updates? So I here's how it works, right? So again, having clients, regrettably, that have been under investigation, um, they've had breaches. Those occurred after we brought on board, but I get access to what's called the data request letter, so I can see what OCR is looking for. So really, the only way they're going to monitor your technical safeguard requirements is if you have a reportable breach. So what will happen is, depending on how egregious the breach is, you may hear from OCR sooner than later. And in the data request letter, they're going to ask you for a bunch of things. They're going to ask you for your policies and procedures, your latest risk assessment. So my speculation is, in terms of monitoring the implementation of technical safeguards, they're going to focus on the technical safeguard part of your risk assessment. And they're going to see if these were implemented. And there's probably going to be some attestation that's involved here. So they will not be proactive. They will not be knocking on the door of your organization and saying, hey, show me all your technical safeguards that you have in place. Only if you have a reportable breach is when they're going to be looking at that. And let's see here, continuing on, how frequently should security risk assessments be updated under the current guidance? So really what it says now is it's really based on a number of factors. Environmental, right? If you upsize, downsize office space, if there's a significant turnover in personnel, if you're adding new information systems, you should conduct a security risk assessment. That's what the current guidance says. Like I've said a couple times now, I usually flip all the cards and say, this should now be done on an annual basis. In lieu of what's coming, organizations should be doing risk assessments on an annual basis. Moving on to the next question, how are OCR investigations typically triggered in HIPAA violations? I just talked about that. So again, the way it works, we saw the breach reporting. If you've never filed a breach notification with OCR, I do have a copy of all the questions. I think it's still available somewhere on the OCR website. So basically, there's about 4 or 5 pages of questions. So you're going to have to conduct your internal investigation, figure out how the breach was caused, how many individuals were involved, the nature of the breach, if it was caused by the business associate, contact information, if it was caused by an employee, was the employee sanctions. So there's a bunch of questions that you'll have to answer when you do file that online breach report. And then, like I said, OCR will review that and then make a determination on whether or not they're going to move forward. You may just get what's called technical guidance. In about 80% of the cases, these are resolved with technical guidance in terms of OCR looks at it and it says, okay, we're not going to look to settle with you. We're not going to put you on a formal corrective action plan, but this is what we want you to do. And you're going to have to provide them. They may say, we want to see a risk assessment completed within 90 days. And once you do that, you may have to send them a copy of your risk assessment. Okay, let me jump back to chat and see if we have any more questions that had come up. So, question that came in, do you have a form of physical training? So I'm not really sure what that means in terms of, are we talking about covering some of the physical safeguards as part of the training? Just to clarify, really what has to occur is HIPAA security awareness and privacy training, and there's specific content that has to be included within that training. So you may get a little organization specific, like we do create organization specific. They may talk about key card issuance or how you secure the facility if you're the last one to leave. So we'll put some added organization specific information in there. But again, my recommendation in terms of physical safeguards is that you include that as part of your overall security awareness and privacy training. Okay, let me jump back to Q&A. looks like we've covered most of this. There's another question on specific HIPAA compliant benchmark for MFA. I think we talked about that, but I really haven't seen anything yet that would, again, a lot of times you're going to see advertising that says that we're HIPAA compliant or we have a HIPAA compliant application. Well, that's good because that means that the organization is signing business associate agreements. But again, unless the organization providing the MFA would have access to any of your data, they wouldn't be considered a business associate, and a BAA would not have to be signed. Okay, so it looks like we've got one more chance for any questions. It looks like we have nothing on the chat side, nothing on the Q&A side. So I'll give it a couple seconds. Again, the contact information is up there. Feel free to reach out by email. Just mention you're on today's webinar. And like I said, I'll be glad to provide a free initial consultation. I know organizations don't like to talk about what they do have or don't have in place. So again, any conversations, obviously initial consultations are extremely confidential. Again, my goal is to educate, provide you some guidance. Even if you're not looking for services, I'll be happy to kind of get those guardrails in place for your organization. So again, just on chat, as I mentioned, I do have a list of the first 5 individuals that did sign up. I just need to verify that you attended, and I'll be getting those out by the end of the week. Any other questions, comments, thoughts? See nothing else in Q&A, nothing else in chat. So with that, I'll just conclude. I do apologize for the technical difficulties. On my end, it said that I had connectivity, but again, we're using a web-based application, so maybe Microsoft wasn't happy with today's presentation, whatever it may be. But again, I thank you all for attending. Like I said, we covered a lot of material. I'll try and get the videos up on the website as quickly as possible. If I can't and you want a copy, please shoot me an email and I will get that to you. So again, thanks everybody for attending and have a great day.